Adelaide's flagship hospital, the Royal Adelaide, recently moved to a new facility at the cost of $2.4 billion. This new facility has implemented new technology, increased the capacity, and created a better working environment. But was it worth the steep price?
It's bigger in some ways.
Yeah.
Certainly in sight it's bigger. It's certainly a lot shinier and it has much better opportunities for eating sushi, and the courtyards are magnificent.
It's a lovely environment to work in. It's actually a beautiful building, whereas the old RA was basically falling down. So it is a lovely new building, lots of great technology, and it is exciting to be a part of something so new.
The Royal Adelaide Hospital covers 10 hectares of land. That's about the size of 2 football fields. Almost 4 of these hectares are dedicated to landscaped gardens and internal green space. It also has 70 courtyards, terraces, and sky gardens within the facility. This new hospital has 800 beds, 700 of which are dedicated for overnight patients, including 40 mental health beds, and it also has 100 single-day beds. Patient accommodation has vastly improved at the new Royal Adelaide compared to its predecessor, with all single-patient rooms focusing on using natural light and sustainability, and having outstanding levels of privacy, comfort, and infection control.
It's gone from wards where they had shared beds to everybody having a single cubicle, and that's both within the emergency department, where we have single rooms for everybody, and the wards where there are single rooms.
Everybody gets their own room, they get their own bathroom, whereas at the old RA you could be in a shared room full of 4 to 6 people. Every room has what's called a day bed, so a loved one or a relative can actually stay with the patient if they want to.
Well, every person who's an inpatient who gets to an inpatient ward will love the quality of the rooms. They are awesome. They're much bigger. You've got room for friends or family to sleep in the same room as you. Lovely.
The new hospital has implemented lots of new medical technology to assist the staff in treating and caring for patients. Some of these new technologies include automated guided vehicles, which deliver food, linen, and other pharmaceutical supplies.
I honestly couldn't tell you how much of an improvement that's been. I think they work reasonably well. There were certainly lots of issues when we first opened the hospital about having the right equipment in the right places and having things stocked correctly. But how much of that was just again to being new personnel?
Automated dispensing cabinets, or ADCs, provide 24/7 access to an increased range of medication through fingerprint passwords. A total lab automation will help the new hospital fully automate the processing of specimens, including blood, urine, and stab wounds. The Central Sterile Services Department will replace paper records and use a state-of-the-art digital system for tracking the new RA's vast collection of medical instruments. There have been downsides to the new hospital though.
It's a very beautiful, shiny hospital, which you look at it and think, I would think it should work better than it does.
When you move into a new house, there's always little issues that you've got to sort out, and the RA has been like that.
The biggest impact has been on what we call access block. So access block is when patients spend longer than 8 hours within the emergency department waiting for an inpatient bed. Before we moved to this hospital, we roughly have 15 to 20 patients on a bad day waiting for a bed at 8 o'clock in the morning. At the moment, it's about 40. Now, that might sort of sound good or bad, but when I have an emergency department has roughly 42 assessment spaces for our ambulance patients, then obviously having 40 patients waiting for a bed is a pretty difficult thing to have, and to have an emergency department effectively working. Length of stay has gone up since the move, and that I think comes back to a lot of these infrastructure changes, some of the IT changes, and just unfamiliarity with the new hospital. the available data would suggest that we're not as efficient at the moment as we were in the old hospital. I'm going to say I want more beds. That's a very unpopular thing for anybody in an executive position to say within the health service, because overall probably the number of beds may be reasonable for our service. But in terms of the overall efficiency and availability of beds for emergency admissions, we're certainly struggling hugely. Because we have so many patients waiting for beds within the department, and we're still getting the same number, actually slightly more patients coming in, we're trying to manage them in a relatively small area. So that makes people feel busier. The nursing staff are certainly busier, as we're trying to look for after the new patients and the ones who've already been waiting with us for 12, 24 hours. As a short-term fix, more beds would certainly help. However, if you have more beds but don't change the way that people work and the efficiency of the hospital, so the length of stay doesn't decrease, what tends to happen is that you just defer the problem for a little bit and then you have the same issue again. So you fill those beds and then you still have patients waiting. So the key is actually ensuring that your hospitals are as efficient as possible. Was there enough consultation with the right people? I don't think there was. I mean, I think definitely not. Some of the decisions that were made were clearly not sensible, in my view, and as soon as I'd heard about the decisions, I expressed that. If we address the efficiency issues, we may all feel different in 5 years' time.
We're always constantly trying to do better and to get better outcomes for our patients. So I think and I hope the way we do work in 5 years' time will be different to how we work now, and it will be better for the patients.